So I am very pleased to be able to talk today about where we're going forward in our program using the AstraZeneca COVID vaccines that we have now in British Columbia. As you know, we had said from the very beginning that once we had a fridge-stable vaccine that would allow us the flexibility to use in more places around the province, we would be targeted at frontline workers and workers in specific at-risk workplaces and industries. We now have 2 vaccines that have been approved by for use by Health Canada, one of which we've had in the province, and that's the AstraZeneca or COVID, which is the Serum Institute of India version of the same vaccine. It's approved by Health Canada and now by NACI for use in adults over the age of 18. And our BC Immunization Committee has been tasked with providing us with the best advice of where we can make the most difference and how to start the use of this vaccine. So the rollout is in 2 parts, the first of which started just this week. The part 1 was the COVID that we received, 68,000 doses that we received last week. That has now been started to being used in places across the province, and I'll provide more details about that. In addition, we now know that we will be receiving another close to 300,000 doses starting, we hope, the last week of March, but we don't have that pinned down quite yet. So it will be the last week of March or the first week of April, and 136,000 doses of the COVID in mid-April, and another 68,000 doses in May. So those are what we are using now to plan the part 2 of this use of this new and effective vaccine. We also heard today on media reports that we might be getting additional doses from the United States. So that will allow us to actually speed up, again, some of those processes. So this is our updated progress using the phases that we have had from the very beginning. And what we're focusing on right now is that gray box down in the bottom, which is the priority frontline workers or people who work in specific industries that are at risk. The part 1, which I've just mentioned, based on the 68,000 doses that we received last week, this is being deployed based on what we know from public health and from the WorkSafe BC and Public Health Workplace Task Group that I put together last November to help us address the ongoing issues that we were seeing in many workplaces around COVID-19 outbreaks and helping boost and the COVID safety plans to prevent outbreaks. But we do know that there are a number of industries that are more at risk, and they are having ongoing and repeated outbreaks. They have unique issues where it's difficult to have physical distancing, where wearing of PPE becomes challenging because of the nature of the work that people are doing. And we know that they're susceptible to ongoing outbreaks, and poultry plants are one of the ones that come to mind. As well, we know that we have ongoing risk and outbreaks associated with congregate housing facilities for workers, whether it's agricultural workers, whether it's workers in some of the resort communities, for example, in Whistler or Big White. So our delivery method in the past week has been around using on-site clinics so that we are able to target workers directly, and that will continue. And for some workers, we've managed to move them in a separate stream through some of our clinics. So where have we seen this rollout so far? The key sectors that we know are the most challenging in terms of managing of outbreaks are food processing plants, and we've seen outbreaks that have affected many people in poultry processing, fruit, vegetable, fish, and meat processing around the province. We know as well that the agricultural operations that have the congregate worker accommodations in farms, nurseries, and greenhouses that are so essential to keeping food on the table across this province. And this is highly supported by our temporary foreign worker program that in BC we've been supporting through providing of a centralized quarantine services where temporary farm workers who are so necessary for this work are quarantined safely and provided what they need. And we'll be looking at immunizing and just started that program, immunizing those workers so that when they go into our communities, we don't see the outbreaks that we saw last year. As well, we know that there's been challenges with the large industrial camps, and we put in place a provincial health officer order around industrial camps to enhance the measures that are put in place. And despite that, we know that there were challenges with workers who come in and out from communities around BC and from other parts of Canada, and they bring the risk with them to these congregate living settings in these accommodations and the large camps, and they take the risk back home with them. So we have been working particularly in the north and the interior to address the risk in those worker populations. We have other large congregate living settings, particularly, as I mentioned, in resort community where isolation and quarantine is very challenging, and where young people are having difficulty with maintaining the distance and the isolation that's needed with these ongoing outbreaks. And additionally, we have a number of workplaces and industries, including manufacturing, warehousing, distribution, where we have ongoing clusters and outbreaks occurring. Generally, they're larger sites. We're focusing on those where we can make the most difference with preventing the second-generation transmission in those outbreaks, and we've seen some of those be responded to in this past week, and I know that there's sometimes some frustration expressed when we are immunizing people and workers who have an outbreak or have been exposed in a large Costco or a glass manufacturing. But these are all places where we know there's been exposure, where we know that transmission between workers also puts our communities at risk when people go home, and it is in all of our best interest to protect everybody in that situation. So what have we been doing? The part one, focusing on these, including in Vancouver Coastal Health, about 16,000 doses to people working in 53 identified food processing facilities, 6 industrial sites, and 5 congregate living settings, as well as the temporary foreign workers who are in isolation in the Richmond area. In Fraser Health, where the largest proportion of these sites are, we're working on immunizing in 71 food processing plants, 48 farms, nurseries, and greenhouses, and a number of industrial work sites with outbreaks. Interior Health has a smaller group of people, primarily focused on industrial work camps and food processing, and a number of larger farms and nurseries with shared accommodations. When we look at Northern Health, as I mentioned, that's where a large industrial camps have meant ongoing risk to neighboring communities as well as outbreaks in the camps themselves. Island Health doesn't have as many of these types of settings, but there are 4 of the large food production facilities that will be targeted, and then we have some doses in reserves for those larger outbreaks that we're trying to manage in different parts of the province. As we move into the second part, when we receive the next shipment of AstraZeneca vaccine, which is, as I mentioned, we're expecting the last week of March or the first week of April, we are going to be refining and moving out to a new group of people as well. So the target groups and the management of outbreaks will continue. All of the important things that we're looking at is all of our data needs to be entered into our provincial immunization registry on a daily basis. This is critical for all of us, and it is something we have focused on from the very beginning, making sure that every dose, every lot number that everybody receives is in our provincial registry, not only so that you have a record of what vaccine you received and when, but it's an important part of our safety monitoring. So we monitor that information by lot number, by every vaccine on an ongoing and daily basis so that we're able to see if signals arise. And we know this is the same process that's happening around the world. We share information, and we've heard about some of the concerns expressed with vaccines in Europe, and it was a safety signal from this type of monitoring that allowed them to take a pause and look and assess those instances. And we're very pleased that we have not seen any of the same types of issues here in British Columbia. In Canada, we've seen one clotting event related to AstraZeneca that was, temporarily related to vaccination, but not related to the vaccine. And again, today, EMA, the European Medicines Association, has come out with a strong support for the risks of vaccination being very low compared to the risks that we have with ongoing transmission of COVID in our communities right now. The eligibility of people for these programs will be validated before they're immunized, and it is important for us in public health to ensure that people recognize how getting vaccine as quickly as possible into as many people as possible helps break those chains of transmission, those clusters and outbreaks in our community, as we are working at the same time with the bulk of our program to protect those people who are most at risk. And we'll have some more information about that coming up. So any of the vaccines that are not yet used from Part 1 will be added into the initiative in the Part 2. We know that people who are affected are people who live across the province in different sectors. Our implementation is going to be more flexible now, using partners in our community. And I have asked and tasked our BC Immunization Committee with looking at all of the recommendations that we have from national bodies, from looking at our outbreak and case data that we have here in BC, and importantly, using our ethical framework for vaccines that helps us determine the parameters that we want to use to identify who should be immunized first in this part of our parallel program. So with that in mind, what we are looking at is the priority groups for Part 2, starting in April, will be first responders, police, fire, and those who work in our emergency medical transport, where we know that maintaining that workforce is an important service, and we have these duty of reciprocity. We'll be focusing as well on K-12 education staff and childcare staff in both licensed and family child daycares across the province, as we know how important it is and how critical it is for families and communities across the province that safe childcare and in-person education is for us all, and the amazing job that we know the early childhood educators, our educators, and our childcare providers have been doing throughout this pandemic. We will also be focusing again on those higher risk industries where we're seeing challenges, including manufacturing, and there's sectors that have been where outbreaks have been ongoing and have been identified, wholesale and warehousing, including particularly food warehousing, staff and congregate housing. As I mentioned, some have been addressed starting in the Part 1 of this program. Correctional facility staff, again, some of the staff have been addressed because we've had ongoing outbreaks in our provincial correctional services and federal correctional facilities, and the inmates in the federal correctional facilities are covered under the federal program, but both federal and provincial staff will be covered under this program. As well, we're looking at cross-border transport, and we're working with the Ministry of Transportation and Infrastructure to identify exactly who the groups are at risk in these communities. Smaller groups of people, including our quarantine officers and bylaw officers. We'll be looking at postal workers, as we know that is also an environment where we're seeing ongoing outbreaks. And many of us, of course, are dependent on the packages that get sent around the country these days. And finally, grocery store workers. And we'll be defining those more clearly for people as we work through this. There'll be hopefully some as well that we can use to continue to target those outbreaks that we're seeing now. So this is approximately 320,000 workers identified in these target groups. Some will already have been started to be immunized in this Part 1 that we're doing right now, and we've been working on the scenario of about an 80% uptake. As I mentioned, this is a fridge-stable vaccine, so that means we can use the infrastructure that we have in our community, and particularly our community providers, pharmacies specifically, and we've been working with the pharmacy associations to make sure that we can do this in an efficient way, and we know that there are many pharmacies and pharmacists who have been part of our influenza immunization program that are ready and able to take this up. About 60%, as you can see from our targeted groups, are people who can be identified through their identification related to their work. And then we'll be focusing the remainder of the activities on the 40% where we will be doing health authority-driven clinics on site, some of which have started already. So this allows us to really move ahead with our large shipment of this vaccine to target these groups of people who we know are essential for keeping our communities going and who have been working throughout this pandemic. And I know there are many other groups that fall into this category as well. And as more vaccine becomes available and our age-based program moves along, we'll also be targeting additional worker groups as we need until we get everybody in BC who wants to be immunized over the age of every adult in British Columbia and in the coming months. And until then, as the Premier has mentioned, we all need to do our part. Do our part to keep us going, to reduce the transmission in our communities as we protect more and more people through the use of our immunization programs. I'm now going to turn it over to Dr. Ballem to talk about then optimizing our deployment.
Thanks so much, Dr. Henry, Premier, Minister. It's a privilege to be here today, and very exciting to just be able to share with you the really remarkable progress that we're making as a province, getting everyone to get the jab, as we say. So this slide is a familiar one for you. It lays out the phases of our campaign that we've been working on, and I think what's critical today is, you've heard Dr. Henry speak about the AstraZeneca and Covishield vaccine and the target groups. And I want to share with you more detail on the more familiar vaccines that we've been working with since December, the Moderna and Pfizer, and how the decisions that have been made and the supply that's arrived just since we last spoke March 1st have really upped the opportunity for us to continue to protect our public. So just to give you a bit of a sense of, how we're doing, there's been a total of 444,000 doses of vaccine administered to our BC public, mostly on age cohorts, as you know, but also in our priority populations over the work we've done in phase 1 and phase 2. And, you can see that Pfizer vaccine so far is the majority of the vaccine that we've used, with Moderna in second place. And, just to share with you the volumes that we're now moving to in the last couple of days since we started our mass immunization clinics for our population in their 80s and 90s, we're doing about 20,000 vaccinations a day in British Columbia. So that's a remarkable increase, and you can start to see the numbers starting to ratchet up as we're moving people through all of the clinics around the province. So, really understanding what's happened since March 1st. On March 1st, we shared with you that we had about 415,000 doses of Pfizer and Moderna coming to the province, and we described the rollout of our phase 2, which was priority populations and our age-related cohorts over 80 and our Indigenous people over the age of 65. But since that time, just in these last couple of weeks, we have gone from 415,000 doses to actually now a projected supply for March and the middle of April of actually close to 1 million doses of vaccine. So really a doubling of what we can expect. So, and essentially we also have the added AstraZeneca Covishield vaccine that Dr. Henry's already talked to you about. We do know that Johnson & Johnson has approved, their vaccine has been approved in Canada. We have no line of sight at this point into what supply Canada will be bringing forth or when it will arrive. So I think it's, one of the fundamental pieces of information here is that we're in a very fluid environment, as the Premier said. Things are changing as we go through our days and weeks, and the job that we have in our health sector and our partners who are helping us deliver this campaign is we have to be nimble. We have to be able to react to these changes and continue to clarify and keep our focus on our objective, which is to get our population vaccinated and protected, to protect our workers, and to keep our health system, strong and protected from COVID, and to actually carry on addressing the pandemic, because it's still with us until we get our herd immunized. So this slide actually shows you a little bit of the elephant that we're going to be swallowing between now and the middle and end of April. You can see that this very rapid rise in the amount of available vaccine in the space of just a month and a half. I'm very happy to report that our whole program for immunization has been able to adjust to this. And what I'm going to share with you is, what that means for our public in terms of their ability to get vaccinated. So if you just looking at this slide, you can see in the pink, that's the Pfizer vaccine, and you can see the rapid increase in Pfizer, and the gray is Moderna, and then the black part of the slide shows the AstraZeneca COVID vaccine that will be coming to us. So in the next slide, I'm going to just walk you through a little bit of the math around here, because one of the important things when you're rolling out an immunization campaign and staffing up clinics to do it is, and in the many communities around our province where this has to happen, it's not linear. It's all happening pretty much at the same time and in a complex schedule. So we really have to know what vaccine we have available and where we have to have it located, and then what's the target population that we're reaching in those communities around the province. So at a very high level, the vaccine supply, we had, if we took March 12th as the starting date of our analysis, we had about 75,000 of vaccine on hand that had just arrived late in the week. We have Pfizer shipments coming in between March 12th and April 18th of about 661,000. And then we have Moderna shipments, which, as you'll remember, come every 2 to 3 weeks, arriving between the same period of time, March 12th to April 18th, of about 170,000. And that totals just under 1,906,059 units. And, as you know, the change that allowed this to happen was really increased supply and the shift from, and the extension of the dose 2. Because as soon as we extended dose 2 to 16 weeks, what that allowed us, it freed up, thousands of doses of these vaccines to allow expanded access for vaccination to our population by dose 1, which, as Dr. Henry has described, is very, very protective. So basically, if you go back to our original plan that we rolled out on March 1st, we were launching the vaccination of the over 80s, the over 65, our Indigenous population. In some areas, we described that the communities would be vaccinated actually as a whole. In very small communities around different parts of our province, it's not a good use of time or resources to come back several times. And so in those communities, usually less than 2,500 will vaccinate the whole population when our teams arrive from the health authority. We continue on an ongoing basis to vaccinate our priority populations. You'll have heard that many health workers, particularly now in the community, are being vaccinated. Our allied health professions, our nurses and support workers who are looking after people on long-term home support, a whole array of direct care providers in our community, physicians, and so on. And we continue to work across the province with the First Nations Health Authority. I'm really happy to report that we're, well underway to finish off by the end of March all our First Nations sites, our reserve communities across the province. So very, very good news for a population that we know has an increased level of adverse events from this virus. So looking at the available supply of vaccine and taking away the plan that we already had underway, we have about just over 500,000 doses of Pfizer and Moderna that we now had to decide, okay, how are we going to use these? So if you go to the next slide, Just to remind you, although these present just logistical challenges to our sector to, on a very short timeline, get this rolled out, it's an incredible opportunity for our province in terms of getting back to normal, because this is another 500,000 people that are going to get vaccinated in a very near time frame. It allows us to move up those age cohorts that we had sort of set out to through April, May, and June. And, really, we're just expediting the protection of our public. So it's very, very good news for both the general population, Indigenous peoples, and, as you've heard from Dr. Henry, our workers. So when looking at how we were going to use this vaccine in a short time frame, we're going to move up the next age cohort from 70 to 79. And although we were going to start on those individuals in April, we're now able to move some of them up into this month, into March, in our clinics. We've already undertaken to expand the clinics that were set up for the over 80s, and we will be welcoming and basically going out to the public to tell people and we'll start with the 75 to 79 cohort and just let them know that we will be in a segmented way asking them to call in and make their appointments in the coming days. So just looking at the math, it's about close to 350,000 that we expect will be coming in to get vaccinated in their 70s. Now, we have another group that Dr. Henry has referenced on a number of occasions, and that's our clinically extremely vulnerable group. This is a group of about 200,000 individuals. About 50,000 of those actually will be covered in the older age group in the 70s, 75 to 79, and some of them will already have been vaccinated in the 80-year-old age group. But beyond that, there's a remaining 151,000. And those individuals, cross all age ranges. And you'll remember that we laid out the different categories they fall in back in January. They're people who are on, very powerful immunosuppressants, organ transplant recipients who are still on immunosuppressants, people in active chemotherapy and radiation therapy, a whole array of groups that our medical community recognize are significantly at risk, and we'll be coming out in the coming days to just make clear what those groups are, and those groups will be receiving a personalized letter from the ministry and the PHSA, who's in charge of this program, and advising them that they're eligible to get vaccinated regardless of their age. So between those two groups, we will cover off the extra 500,000 doses of Pfizer and Moderna that are coming to us. When we look at the feasibility for the different health authorities to actually ramp up this activity, I would say in the Lower Mainland, both Vancouver Coastal and Fraser have more large clinics. It's a bit easier and it will be faster for them to expedite opening up more capacity. And in the interior, the north and Vancouver Island, particularly in the northern part of Vancouver Island, they'll be working hard with us to ramp up their activity, probably a bit more back-end loaded toward the middle of April. So we're very confident that we are going to be able to use this vaccine in a very timely, expedited way to move up our population protection. So, this slide just very simply walks you through the numbers of the different groups and shows you that at the end of it all, we have about 44,000 doses of vaccine that we will either have used up because we get more than 80% uptake, which is about our average, or we'll roll into the group receiving vaccines, the next age cohort after April 18th. I just want to note that we will be keeping a reserve of vaccine, and that's because it's not uncommon for our Pfizer, and particularly for Moderna, which only arrives once in a 2-week time frame, to come a few days late. And although during the first 2 phases of our campaign, we were able to manage that because we were working with our own staff who were getting vaccinated and different priority populations, and we were able to reschedule them and move on. But with the volumes now that we're going to be vaccinating, and the fact that it involves large numbers of people in our general public, we do not want to be canceling vaccination clinics that have already been scheduled. And so we're keeping a bit of a reserve, about 140,000 doses, which is 3 days supply to actually make sure we've got that nimbleness. And if the things arrive a bit late, that we're able to fill in that gap and proceed as planned with our scheduled clinics. The next slide just shows you, you'll have seen in the last week, I think we all experienced the call center issues we had on the first day of our rollout, which is a very typical experience across our country and other jurisdictions around the world. You know, when you first open up your clinics to the general public, they're very enthusiastic, and that's good news. We want them to want to get vaccinated and to be getting in there to get an appointment. But it really challenges the technology of call centers and online registration. So, you know, what we moved to was a segmented process, and we've been working with our partners at our TELUS call center to segment the population, and I'm very, very happy to report that our public they understand the need for that, why it works better for them. We have virtually no wait times on our call centers the end of last week and this week, and yet we're scheduling even more people every day. So segmentation of the age group seems, you know, pretty practical and simple, and so this is just an example of what our planned schedule for segmenting our 75 to 79 age group for next week will be. And, you know, these things may shift a little bit, but essentially it's really about protecting our public from having to wait in long queues that are not necessary. If they wait till their age cohort is called by year and year of birth, you know, they will get a very fast response and be able to book their appointment. And what we know is when people have an appointment booked, they just relax and they feel very, very confident and, you know, really much safer. And I just think that our experience really over the last week has been incredibly heartwarming. Seeing all these seniors come in and get their vaccination, and really they're so happy and they're crying, and it's just really been a remarkable thing for all our staff to just see just the impact of these clinics on our population. Now, going back to sort of the impact on the health authorities and just being able to understand, you know, what they'll be doing in order to respond to this increased vaccine. On the top line of this slide, you see incremental clinic bookings. And essentially, you know, it's about 420,000 that we expect to drive through our immunization clinics. And you can see by health authority the range of you know, increased activity that they'll be managing, not just in one clinic, but in clinics spread around their whole geographic region. With Fraser Health Authority, you know, having the highest amount, and that basically relates to their large population. And interestingly, the Interior, Vancouver Coastal, and Vancouver Island all have about the same number, because Vancouver Island and IHA actually have, you know, even more seniors in their 70s than even Vancouver Coastal. So these things, you know, as you go through different age groups, you have to watch the impact on the different authorities and make sure that they've got the proper support to be able to respond. And the next line just really gives you an idea of, you know, what the burden on a daily basis of additional clinic visits will be across our clinics. About half of the 150,000 clinically extremely vulnerable patients will come in through our clinics, and the other half will organize their access through different programs across, really provided by the PHSA. You know, many of the programs in which these patients reside are run as provincial programs, the transplant program, our cancer centers, you know, small groups like patients with cystic fibrosis. They will then, the other groups, those with severe asthma and COPD, and those patients with severe diabetes as examples, those people on immunosuppressants are quite large groups, and those we expect that they'll flow through our immunization clinics. You know, just a note about our smaller health authorities, they're working hard in every community, because these patients are spread across our whole province, to make sure that, you know, as quickly as possible we're ramping up the capacity, you know, to see these patients and our age cohorts into their clinics. So moving on to just deployment of the vaccine, I talked about the scheduling. We're very happy with our call center. We will be bringing online our provincial digital platform that I've talked to you about before. It's a great system. I think it's making Dr. Henry very, very happy. It's basically a massive transformation of our ability in our immunization programs, throughout the age groups and all different kinds of vaccines. This will allow us to track everyone. It will provide an opportunity a few months down the road for the public to access their vaccine records, and for physicians and pharmacists to actually make sure they are able to access those supplies when they're seeing patients. And we've talked about the AstraZeneca rollout as well, and how that will happen, in great partnership with our community pharmacies. So just moving on to this slide, because the transformation and transition to the provincial digital platform is a tricky business. As you know, we're working currently with 5 call centers in the health authorities, and they will continue to schedule people right up to April 18th and get them scheduled in all these clinics. There's about 198 clinics currently, and that will drop down a bit as we get our oldest seniors through, but in the range of 170 clinics around the province. And we will continue to schedule them through our 5 call centers over the course of the next few weeks. And then on April 6th, we will do the shift over, and we will close down those 5 call centers and those numbers, and we will move to 1 provincial call center and 1 very robust online booking platform. And the public will then start to be able to access, wherever they are, that online system and or the call center who can help them book an appointment. And that is what we will proceed through the rest of our vaccination and immunization program for COVID-19 using that platform. And just a little bit about that platform, it will allow people to go in and register pretty much at any time. We have mechanisms to gate that so it doesn't collapse under the enthusiasm of the remaining people to be vaccinated coming in. It will then allow you to schedule an appointment. You'll get a reminder that you can schedule an appointment. And the reason for that is we can gate that so we don't have everyone scheduling at the same time. And then it will actually run our clinics. We will be using the same system in our clinics and tracking all the different work processes in the clinic. And finally, it will be a remarkable tool for reporting out, for us to track our business and how we're doing, and to continue to adjust our processes. So in summary, so this is our vaccination timeline now, moving up. As you can see, this is very, very good news for us. So, in March, we will we're continuing to do those who are aged 80 and Indigenous peoples. In April, and even before April, we are probably going to get some people in their 70s into our clinics to vaccinate them as we incrementally bring on capacity. And in May, we'll be at a minimum, pending new news about new vaccine arriving, people aged 59 down to 40, and in June we'll get our younger group vaccinated. And this is remarkable progress if you think back to January when we were talking about September to get this done. Now we will have second doses, and that will happen in a structured way consistent with the evidence, as Dr. Henry has indicated. And in the meantime, you can see in the yellow across the bottom of this slide that we'll have all of these different worker groups in the AstraZeneca COVID-Shield program who will also contribute to the protection of our population. So in summary, as of March 12th, we're looking at a bounty of vaccine, which is, a remarkable opportunity. We are working very hard to respond to that and move up our population, accelerate their vaccination and their protection. This is a real benefit, particularly in the Lower Mainland, where we have an outbreak that is particularly difficult. And so it helps all of these things. It helps us manage our pandemic, protect our hospitals, and, advance the protection of our population. And by our calculation, just with the Pfizer and Moderna, without considering the impact of AstraZeneca, we will have about a quarter of our population vaccinated by the end of next month. So the additional coverage by AstraZeneca will contribute to this, but essentially this is good news for our public. Very happy to be here, announcing this, and there will be more to come. Thank you so much.